Let's talk about eyelid surgery, aka blepharoplasty. It's probably 80% cosmetic and 20% functional. And what do I mean by that? For the most part, eyelid surgery is done to rejuvenate the look of the eye. We're taking out excess skin, we're redistributing volume, we're changing the way that the tissues sit around the eyes to create a more youthful look and to restore the appearance of a younger face. However, for some patients, the amount of excess eyelid skin or the amount of drooping that they have can become so excessive that they actually may not be able to see as well as they did before. And in that case, it can be a functional surgery as well. Blepharoplasty can be divided into two categories, upper lid surgery and lower lid surgery. But more often than not, it's combined into both. When we're addressing the eyelids, we're usually addressing some combination of excessive skin and maldistributed fat, as well as lines and wrinkles. And typically, when somebody has these changes in one eyelid, they oftentimes have them in another eyelid as well. So some patients who are younger may find that they just have the aged appearance of the upper eyelids, which is often congenital, they're born that way. Or it may just be eye bags or hollows underneath the eyes. And so in isolation, these problems can be addressed with one type of surgery, either an upper bleph or a lower bleph. But as we age, more often than not, we tend to see all the hallmarks of aging. Excess skin, maldistributed fat, and we're gonna plan to do both the uppers and lowers at the same time in order to achieve the best result with a maximum impact. So the best part about blepharoplasty surgery is that while the scars are imperceptible, the difference between what your eyes look like before and what they're gonna look like afterwards is like night and day. But because you don't have any incisions left behind, people are gonna wanna know what peptides you're on, if you got a new mattress, how you've been sleeping so well. You're gonna look completely refreshed and rejuvenated, and for that reason, it's one of my favorite procedures. So there's certain things about a blepharoplasty that just cannot be avoided. If you're undergoing this procedure, whether you only do the uppers, you do the lowers, or you combine them both together, you're going to look pretty beat up for a couple of weeks. Typically, you're gonna have that very swollen, puffy look around your eyelids with a substantial amount of black and blue underneath the eyes for about 7 days. And over the next week, that'll transition into that green, yellow, more dull bruising that can be concealed with a little bit of cover-up or makeup. Your stitches will stay in for about a week, but I would typically recommend for a patient undergoing a blepharoplasty to plan to minimize outdoor activities for 7 to 10 days after surgery and to pretty much plan to stay out of the limelight for about 2 weeks. Small changes around the eyes can make a huge difference in rejuvenating your face.